So I'm going to talk about the Health Data Research Service, and I think it is important that we share this information because it will be hopefully something that has a very significant positive impact for all researchers in health data space. I work for the Wellcome Trust, and I'll just say a word or two about the Wellcome Trust, just to put it in a bit of context. Wellcome is one of the world's biggest philanthropic health research funders. It's the biggest charity in the UK, and it funds curiosity-driven research into life, health, and well-being. So you can see we have a pretty broad remit there. Traditionally, I think Wellcome has been most famous for what we might term discovery research, and that doesn't just mean drug discovery. That means anything really at the fundamental research level, from atoms and molecules all the way through to social sciences. But more recently, Wellcome has also declared other priorities, and those include infectious diseases, climate and health, so the impact of climate change on health, and mental health. I work in the Data for Science and Health team, and our function is to fund trustworthy data science to advance these goals. So effectively, we work right across all these priorities, but with a specific lens of data science. So as you may well have heard, the Health Data Research Service was announced by the Prime Minister in April this year, for some reason at a visit to a car factory, yet to be explained why. But the objective of this initiative is to simplify access to UK health data for research purposes right across the 4 nations of the UK. The budget of the initiative has been announced as up to £600 million for over 5 years, so a very significant budget, of which Wellcome is a partner contributing £100 million. The Health Data Research Service is open to partnering with other not-for-profits, but as of today, Wellcome is the only partner for the government. Health Data Research Service will provide access to all sorts of health data, significantly including NHS data, of course, but a new organisation will be formed to run HDRS, so it will sit outside of the Department of Health and Social Care. So the core capabilities of HDRS are to provide linked national scale primary care, hospital prescribing and deaths data. So all that data that you'd find in the NHS, but significantly, I think that word linked, which is often very difficult to achieve today. It will also provide access to data from consented research participants, initially on the UK's flagship assets, the likes of the UK Biobank or Our Future Health, but also encompassing potentially other sources. It will provide access to diagnostic images, lab results, pathology, genomic and clinical letter data. It will facilitate faster clinical trials through linking research-ready health data and a closer partnership with the clinical research delivery infrastructure. It will provide a single point of access to NHS data with a standardized commercial agreements. So in other words, it will simplify the very complex landscape that we see and I'm sure you've all experienced when trying to access NHS data, particularly when that data sits is geographically distributed, or when it sits across different NHS trusts. And finally, the intention from the beginning is to support the linkage of data, very much like we've heard from previous speaker today, of between health data and sectors outside health and care. And we're also cognizant that that the Department of Science, Innovation and Technology is simultaneously developing the National Data Library Initiative, and we would see the Health Data Research Service as an integral component of that in the fullness of time. So HDRS is very much at an early stage of its creation. There's a lot of quite boring back office work to be done, but equally hugely important. One area that the Department of Health is focusing on at the moment is the development of a business case to release the government funds. There is also quite a significant task to form a new organization, and so that new organization will be a GovCo, so an organization that's wholly owned by the government. And of course, that will require the recruitment of key roles within that organization. Some engagement exercises have begun, and I think there are 5 groups that have been formed to help help build our understanding of what HDRS needs to do and how it might do it. Those groups are academia, industry, NHS data providers, research funders, and the devolved nations. So quite a spread across there, not intended necessarily to be a comprehensive consultation by any means, but purely to inform the team developing HDRS on the direction of travel and to fill important gaps in our knowledge from consultation with these experts. From the Wellcome side, Wellcome has contracted Emrys Health and a consortium of which they're leading to conduct a landscape exercise. I'll say a little more about that in a moment. And if you want to find out more about HDRS, the government is hosting a webinar on the 18th of November. I'm sorry I haven't got a link here for that, but I can provide that afterwards if needed. So to say a little bit more about Wellcome's initial contribution, the first major piece of work which we're undertaking is this landscape report. The objective being to inform the incoming CEO of the new organization about the data and infrastructure landscape in health data across the UK. We've run a public tender, and the contract was awarded to an organization called Emrys Health. They are a group of very eminent health data experts, many of whom will probably be familiar to you. And they are beginning the work by first of all a desk exercise where they're looking at many of the existing resources around health data, and there have been a number of studies in recent years which are still highly relevant, not least the Sudlow review. But that will be followed by interviews and workshops where they will engage with stakeholders from right across the health data spectrum, and that will include significant engagement right across the UK and across the different nations. We're very keen that this work should be transparent, and the report will be published by Wellcome in the new year. The team is very open to engagement and keen to hear from experts with knowledge of the sector. So there is an email address there if you wish to contact them and feel you have a particular viewpoint which should be represented. I will also say something a little bit about the organization. And I mentioned that HDRS will be operated by a new organization. It will be wholly owned by the government. And we are currently recruiting the chair and CEO. The chair is necessarily slightly further along the line in the recruitment process than the CEO, and we hope that the chair will have potentially some input into the CEO recruitment process. So we expect the chair to be appointed fairly soon, and the schedule was for the CEO to be recruited before the end of the year. The new organization will be located on the Wellcome Genome campus, so a nice link there for Wellcome, and also the opportunity to benefit from that ecosystem of health data specialists that exists there through the Wellcome Sanger Institute and also the likes of the European Bioinformatics Institute that is co-located. But it's worth emphasizing that the investment, that whilst the headquarters will be there on the Wellcome Genome campus, there will be investment from the HDRS right across the UK. And just to sort of mention a few of the sort of challenges that we see from HDRS, and many of those just come from the sheer complexity of the environment. And this is, necessary in the sense that I think what HDRS can bring to health data research is to simplify access to data. In many ways, it won't change things. It won't change the way the way that data is governed or who can access data. What it will change is the way that you can access it and make data much more available and easy to access. But the issues around that simplifying that complexity, it is a big challenge to integrate elements from four nations' health systems. There are a large number of local data controllers and data systems, and there is a distinct lack of common data standards, processes, and governance procedures. We're also working on quite an ambitious timescale. So we've announced that we want to see some degree of operation by the end of 2026, which is rapidly looming. We are at the moment anticipating the needs of a yet unformed organization. So this is a new organization, and we can only guess at this stage what direction they will want to take this in. But we are trying to give them the best possible start by having as much information to hand in this discovery phase as we can. And we're also conscious that the UK doesn't exist in a vacuum. There are significant international developments in this space, not least the European health data space. So we will be keeping an eye closely on those. And certainly not least, the trust of the public and patients and of healthcare professionals is absolutely paramount, and we are very, very conscious that without that, this will not be a successful exercise. So I think I'm coming to the end of my time, but just to say, Wellcome is hugely supportive of HDRS and highly committed to its success. It's a real privilege personally for me to be involved in this sort of once in a generation project, but not to say it isn't daunting. We feel that there is huge potential to change the health data landscape, and work is well underway in terms of informing strategy and establishing the structures which we need for success. And finally, just to reiterate that point about the trust of the public, as I'm sure you're all conscious in your work, the trust and acceptance of the public and their understanding of the benefits of health data research is absolutely essential to this work. So thank you very much.